This segment of your life has been brought to you by Mini Dental Implant Centers of America.
Welcome back. It's the tail end of our show, which means it's time for our tail end segment. This week we have a progress report on my dog Bucca. 2 weeks ago today she had surgery on her right rear leg to repair an ACL tear. Now the rehabilitation begins. It's 4 weeks post-op for Bucca. We're anxious to know how's she healing.
She is healing wonderfully.
We are doing the ultrasound every day, 20 minutes.
Excellent, excellent. So what we are looking at is her post-operative osteotomy site, which is running right here. Typically at 4 weeks we still see a very defined line, and we're not seeing that with Bucca, so that says that she's healing very well and ahead of schedule. She looks wonderful.
Meet Bucca. She's the rescue dog who truly taught me the meaning of man's best friend. At only 6 years of age, my furry friend has been through a lot these past several months. It started when she all of a sudden had a hard time walking on her right rear leg.
No signs of osteoarthritis in this knee, no signs of neoplasia or cancer anywhere.
After being told by a general veterinarian that Bucca could have everything from osteoarthritis to cancer, I brought her to one of the top orthopedic and rehabilitation centers in the country to confirm that she actually tore one of the main stabilizing ligaments in her knee. The cranial cruciate ligament in dogs is equivalent to the human ACL that we hear so much about in sports news. There are several surgical options to deal with this common injury in dogs.
Now you can start seeing where it's actually torn.
Since Bucca is young, healthy, and active, we chose to repair her knee with this innovative bone reshaping procedure called a tibial plateau leveling osteotomy. Dr. Sherman Knapp invited me to scrub in on the case to better appreciate the procedure and the rehabilitation my dog is about to face.
And the way we think of it is if you think of the top of the dog's tibia, it's very sloped, and the bottom of the femur is round. So think of this like your car being parked on the hill. Without the emergency brake, it just wants to slide down the hill. The CCL is the emergency brake. We can take this hill and make it a flat parking lot. We take away the need for the emergency brake. So it's sort of like moving from San Francisco to Kansas.
She's doing great. So she's in recovery right now. She did well overnight. She's eating, drinking. Typically for a TPLO post-surgical, one of the biggest things is going to be restriction and confinement.
24 hours after surgery, Bucca was discharged with a list of post-op instructions.
What we're going to go over is range of motion of the hind leg post-operatively for the TPLO.
And exercises to get her leg moving. It's amazing to think that this pup just had major surgery. To help speed up her recovery, a synthetic bone graft was applied to her surgical site. Plus, during the healing process, we will be using this ultrasound device every day at home.
This is basically a pulsed ultrasound system that promotes bone healing. So what we're trying to do is speed up the bone healing of the osteotomy site. Normally it takes about 8 to 12 weeks for a bone to heal. What we're trying to prove is that we can actually accelerate that healing so we can get bone healing anywhere between 6 and 8 weeks.
It's 2 weeks after surgery and it's time for a recheck.
Good girl, Bucca. That was good.
The gait study showed that Bucca is already starting to put more and more pressure on her surgical leg. She's also starting to gain a lot more confidence.
And it's hard with patient compliance being a dog because that rabbit's out there. I don't think she feels any pain.
No, none at all. That rabbit talks to her and she's like, I'm fine. I'm fine. Good girl, Bucca. Excellent job.
She knows they're trying to help her and it feels good.
Dr. Deborah Knapp also used cold laser therapy on Bucca to help reduce some of the swelling.
There's a ton of papers out there on light therapy, phototherapy, and it basically uses the nanometers of light range to heal tissue, to stimulate cells to heal themselves. I always say to my clients, it stimulates cells to be the best that they can be. This is actually FDA approved for arthritis in people.
Bucca's exercises were also taken up a major notch.
What we want to do is weight-bearing exercises to build muscle ups, and I'm going to pick up the other limb and hold that up for a count of maybe 3 to 5 seconds.
Ooh, that leg's shaking.
Yep, you got it. And the reason why it's going to shake is because there's muscle atrophy there. In the beginning stages, she's only 2 weeks post-op, literally just taking a couple seconds, really supporting her underneath and lifting that leg up so she's waiting. Good girl, excellent job.
And here we are now, 4 weeks post-op. Since Bucca's x-rays show that she is indeed healing ahead of schedule, she took the plunge with water therapy.
When she's just 4 weeks post-op, we take the water to a very high level, so that gives her a lot of buoyancy. It takes the weight off of her limbs. So that way she's not putting an excessive amount of weight on that leg, but she's allowed to move through the water and use the resistance of the water to build her muscle up.
And the proof is in the numbers. Bucca's muscle mass measurements are improving. She's bearing more weight on her leg. Still, the daily exercises, ultrasound therapy, and restricted leash walks have to continue to give my canine kid the best chance of getting back to her active, playful life.
Surgery is a very important part with healing the dog's cruciate ligament, but the after therapy, both rehabilitation therapy and the care that you are giving at home and the care we're giving here is a very important part to get your dog back to functioning to its fullest ability. So it's important to abide by the restrictions. It's important to call if you have any questions or concerns, and it's very important that we get to the same goal that we all want. The goal is to get them back to live better, play better, and feel better.
We'll be following Bucca's progress over the next several weeks. If you have any questions about this segment or any of the segments you saw on this week's show, check out our show's website, yourlifetv.com. Until next week, remember, it's your life. Live it and live it well.
High five, Bachi, high five.